Hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the inside part of the knee, or the medial compartment. What you see there is a shaver, and you see how it's spinning around. It has suction attached to it. I just stopped it from spinning so you can see it. And so as we spin that shaver and the suction works, that's how we can smooth out any rough areas initially, and then also the suction will bring any loose pieces into view. Like there's one of them right there. That wasn't a big one, but at least you can see how it kind of works there. I'm going to straighten your knee out a little bit, and we'll get a better look towards the posterior horn here. There's a bunch of loose pieces. See some more there? And so with our suction, we can very quickly evacuate those, but there should be even more than that based on what the MRI scan showed. Here's one of the places these loose pieces may be coming from. You can see how that could happen. These could break loose here. Okay, and so this is on the medial femoral condyle. I'll show you on a model back in the office, but right now, just to try and prevent this from getting worse, I'm going to smooth out anything that's clearly about to be loose without taking away anything that looks kind of healthy. But you can see this little area right here doesn't look great. This is why we talked about doing the platelet-rich plasma or even the stem cell injection in the office. And I definitely think we need to do that to try and get this cartilage to recover a little bit. That'll help with that. In terms of the meniscus on this medial side, other than trimming it back a little bit, I don't really see any significant tears. We'll keep looking and show you some more in a little bit. Pause. Let me get a basket just curved up. Okay, so we're looking in the notch now. This is where the anterior cruciate ligament lives. That's it right there, kind of behind some of that soft tissue. It's very vascular, so I don't want to shave it if I don't have to. But sometimes the loose pieces get trapped up in this tissue. I don't see anything right now. We're going to go ahead and take away the lateral post in just a minute. Pause. Okay, so this is the lateral compartment. You can see this meniscus is a little bit more frayed on the inner edge. That's the type of tearing that our shaver can take care of pretty quickly here. So far, I don't see any other more significant tearing. You can see the cartilage is also a little bit soft. Here's the posterior horn. That looks pretty good. But I don't see anything else that's really unstable there. So I'm going to look in the suprapatellar pouch next. This is where a lot of loose pieces often hang out. And for right now, we'll just go ahead and turn on some suction and see what we can find. This is the medial gutter. It looks pretty clear. We'll come back up in the suprapatellar region and go into the lateral gutter next. And here's the lateral gutter. As I pull back, I just lost a little bit of water. Yeah. Okay. So as we pull back here and look in this lateral gutter, that looks pretty clear also. So I think we're almost done. We've gotten out some loose pieces, which is what we came here to do. I'm going to go ahead and take one last look at the patella here. And you can see how soft it is at the top of the screen. Again, another reason for our regenerative medicine injections, because this is where these loose pieces are coming from as the cartilage gets soft. So the trochlea here looks pretty good. The patella, though, not so much. The medial facet over here, looks okay, but the lateral facet right there does not look great. So I'm going to do one last thing, because I don't think I can get to that area very easily. Maybe I can. Yeah, if I can get there, then I won't have to change positions with the camera, but it looks like I can get there. So besides the loose bodies, you've got some arthritis behind the patella and primarily in the medial compartment. I don't think there's anything loose there. I'm going to go ahead and go off on the video. We're going to change positions one more time, but then we'll finish up. Okay, so now we're looking from the medial side. Here's our shaver coming in laterally, and you can see how we have a much better angle to get to this area of the cartilage that is generating some of those loose pieces. And I think that's pretty much it. I don't see anything else loose to worry about. Nothing else loose in the suprapatellar recess here. So I think that's it. We're going to go ahead and finish up and get you back to the recovery room shortly. Good luck to you now. Bye-bye.